Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Jugular venous pulse. Okay. Normal jugular venous pulse height is around 6 to 8 centimeters of blood. So in the jugular venous pulse, we have total 5 waves. A wave, C wave and V wave. So this is A wave, C wave and V wave. We have X descent and we also have Y descent. So this is the jugular venous pulse. So what does A wave signifies? A wave. What does A wave signifies? A wave signifies that it corresponds to atrial contraction. Whenever there is atrial contraction, then the pressure in the atria obviously raises, thus producing this positive wave called the A wave. Then we have C wave. This C wave signifies the bulging of the tricuspid valve into the right atrium. This bulging of tricuspid valve into the right atrium is seen mainly during the ventricular isovolumetric systole. Why? So, if you see, if this is the heart, first, when the atria has contracted, atrial contraction will result in flow of blood into the ventricles and it results in A wave. Later, the whole blood has been flowed from atria into the ventricles. Now the pressure in the ventricles increases more than that of atria. The pressure in the right ventricle increases more than the atria. In such situations, this valve will close. Okay, when this valve has closed now because now the valve has closed, now the ventricle has entered. Okay, now the ventricle is filled completely with the blood. Okay, because it has filled completely with the blood from the atrium. Now after this, what happens, the ventricle will start to contract. So ventricular systole will start. So ventricle will start to contract. When the ventricle is contracting, then this tricuspid valve will bulge into the right atrium like this because of the contraction of the ventricles. Now because of bulging of tricuspid valve into the atrium, now the volume in the atrium will be less, so the pressure in the atrium will increase, resulting in this C wave. So C wave signifies bulging of the tricuspid valve into the right atrium during the ventricular isovolumetric systole. That is C wave. Then we have V wave. V wave is whenever there is increased volume of blood in the right atrium results in V wave. So V wave is mainly when there is blood flow from the when there is blood flow from the right and left when there is blood flow from the inferior vena cava and superior vena cava, then we will have this V wave. Okay, then we will see the descents. The next is we have X descent. Okay, this X descent is actually seen whenever there is atrial relaxation. Atrial relaxation will result in X descent. And because there is atrial relaxation, obviously there is downward displacement of tricuspid valve will be seen in this condition. Here there is atrial relaxation is responsible for X descent. Now we have Y descent. In Y descent occurs because of opening of tricuspid valve And when there is opening of tricuspid valve and in rapid inflow of blood into the ventricles, into the right ventricle, because of opening of tricuspid valve and rapid inflow of blood into the right ventricle, this will result in Y descent. So this X descent will actually, okay, this X descent will correspond with the heart sound S3, whereas the A descent will actually A descent will correspond with S4. A descent will correspond with S4, whereas Y descent will correspond with X3.
Thank you and thank you for watching.